So that is the reason we always try to achieve normal anatomy in the osteoporotic compression fractures. So that's about the basic biomechanics. So once you see a patient and you suspect an osteoporotic vertebral compression fracture, then how to go about assessing the patient? You obviously take X-rays. You can go for MRI scans, CT scan, radionuclide bone scan, and you know, this is osteoporosis is a vicious cycle. They can go into kyphosis and it reduces the pulmonary forced expiratory volume. So you probably have to assess the pulmonary function test also. So this is one of the patients who came to us, and you obviously see some amount of compression in the lower dorsal spine. But based on this X-ray, can you tell me, is this a fresh fracture or is this a old fracture? It's more or less impossible to say on the X-rays whether it is a fresh vertebral compression fracture or a old healed vertebral compression fracture. So that is the reason X-rays alone are not sufficient to make a diagnosis of fresh vertebral compression fractures, and you have to go ahead and do an MRI scan. This is another thing with X-rays you should be able to do. If you look at this X-ray was taken in standing position, and this X-ray was taken in the lying down position or the sleeping position. And if you actually look at this, you see the fracture opening up in supine position. So that shows there is some amount of non-union in the fracture, and it is opening up in lying down position. And if you can place the patient on the operating table in this position, you should be able to squeeze in some cement into the vertebral body. But if you look at this X-ray, you will never be able to squeeze in the cement in this position. So that is the reason you should have the dynamic films whenever you are taking X-rays. So you should take X-rays in the loading position, and you should take X-rays in sleeping position. So that is the importance of having X-rays. Then comes the MRI. We mentioned on the plain X-rays we will never be able to make a differentiation between a fresh vertebral compression fracture and the old vertebral compression fracture. For that you need to have